Hello, I'm Dr. Chander. I'm a board-certified cardiologist. Atrial fibrillation is a condition of the heart where your heart beats irregularly, most of the times fast, and it also puts you at a high risk for stroke. Whenever a diagnosis of atrial fibrillation is made, the first thing is whether this is a pure electrical problem of your heart or is it a sign of something else. For example, enlarged heart, weak heart, congestive heart failure, blockages of the heart arteries, valve problems, lung problems like emphysema or COPD, overactive thyroid, or even overwhelming infections can make you prone to atrial fibrillation. Some key points about atrial fibrillation. Number one, every time you have flutters in the chest or feel palpitations, that does not mean you have atrial fibrillation, because similar symptoms can be caused by extra beats or missing beats. And in most of the cases, a diagnosis of atrial fibrillation can easily be made by doing a simple test called electrocardiogram. Number two, if you have pure electrical problem of your heart, in most of the times, atrial fibrillation is compatible with long life. About 2.2 million people in the US have atrial fibrillation. Number three, atrial fibrillation tends to be a recurrent disease in most of the cases. Number four, not everybody who has atrial fibrillation needs blood thinners like Coumadin or newer drugs called like Pradaxa, for example. Your proneness to stroke from atrial fibrillation can be determined by doing a scoring called CHADS score. It's an acronym, CHADS. And your physician can sit down with you and help determine your CHADS score. And another major key point is, how do we treat atrial fibrillation? I will discuss that on my next video. I'm Dr. Chander. If you want to know about my upcoming videos, you can subscribe to this channel by clicking on subscribe button just above this video. And if you want to share this with your Facebook friends, right below this video there is a button called Facebook. I'll see you next time.